Creatine and statins don't actually interact the way most people worry they do. There's no liver enzyme conflict, no change in how much statin ends up in your bloodstream, and no major drug database flags this combination is dangerous. But here's the part that catches people off guard. Creatine can quietly raise a lab value your doctor uses to decide whether your statin is damaging your muscles. And if your doctor doesn't know you take creatine, that one lab result can cost you a medication you actually need. As a pharmacist, this is the scenario I see far more often than any real safety emergency. Someone on Lipitor is taking creatine for the gym, their routine blood work comes back with an elevated reading, and suddenly the conversation is about lowering or stopping the statin when creatine was the more likely explanation all along. And it doesn't matter much which one you're on. Lipitor, Crestor, Zocor, Pravachol. The same trap applies. The lab value at the center of this is called creatine kinase, or CK. It's an enzyme your muscle cells release when they're stressed or working hard. It's also the main marker doctors use to detect statin-related muscle injury. So when CK comes back high, the statin is the usual suspect. The problem is that creatine supplementation, especially paired with intense exercise, can raise CK on its own without any real muscle damage at all. That's the trap. High CK plus a statin plus a doctor who doesn't know about your creatine can add up to an unnecessary dose reduction. And that statin is very likely the medication doing the most important work in that combination, lowering your risk of heart attack and stroke. Now, there is a real biological overlap worth knowing about. Both creatine and statins touch muscle tissue. Statins cause muscle aches in some people, and in those already prone to statin muscle symptoms, the combination can make things harder to interpret. That is not the same as saying creatine is dangerous with a statin. For most healthy adults on standard doses, it isn't. But a few groups should talk to their provider first. Anyone already having muscle aches on a statin, anyone on high-dose Zocor or high-dose Lipitor, anyone with kidney problems or a history of muscle breakdown, and older adults. So what should you actually do? First, if you already take both and you feel fine, you don't need to stop. Second, and this is the one that matters most, tell your prescriber you take creatine. Every visit, one sentence. It lets them read your CK correctly instead of blaming your statin. Third, if you're just starting creatine, ask your doctor to check a baseline CK first so future labs have context. Fourth, stick to the studied maintenance dose of 3 to 5 grams of creatine monohydrate daily and stay well hydrated. The honest bottom line, this isn't a dangerous combination for most people. It's a communication problem dressed up as a drug interaction. The single most valuable thing you can do is make sure the person managing your statin knows about your creatine. I've put the full breakdown, including exactly who's most at risk, how to choose a quality creatine, and the questions to ask your prescriber on LiveHealthyRX.com. The link is right below this video, and if this was helpful, consider subscribing. I cover supplement and medication questions like this one every week.